Hello po, and Maya Pog 2 po. Happy lunch. We're almost lunchtime, and natagalan po tayo because we're discussing, and I found it quite difficult actually, to review the Sputnik, also known as Gamaleya vaccine. Okay? So my name, Dr. Anna York Bondoc. Thanks for joining us today. And please join us. We do have a YouTube channel. Please like and subscribe. Meron din po kaming Facebook Live at least 3 times a week. Please put your questions down below. Like, follow, subscribe. Sasagutin po natin lahat ng questions regarding Sputnik and Gamaleya. Of course, you're welcome to put your COVID questions. And kung meron pong mga tanong na non-COVID, we will read it po at the end. Okay? So don't worry, pwede pa rin po. So let's start po with the Sputnik and Gamaleya vaccine. Can you just type first Sputnik vaccine, also known as Gamaleya? Okay? So yun po yun. Sputnik vaccine, also known as Gamaleya. So tara, let's start. Okay. I think the first statement was placed, what is the Sputnik vaccine? And marami pong nagtatanong din, naririnig po natin, Sputnik, Gamaleya, ano nga ba yon? So to let you know, no, Sputnik is the same as Gamaleya. This is the vaccine that was developed po in Russia. And it was named po Sputnik in honor po of the Sputnik, which is one of the first Soviet spacecraft actually that went to space. Naunahan po niya ang US, so it represents a Russian triumph. So Sputnik po, plus it is a world-known name, Sputnik. Okay, bakit ho Gamaleya, also known as Gamaleya? Okay, why is it also known as Gamaleya? It was developed po at the Gamaleya Research Institute of Epidemiology and Microbiology in Russia. So this is a respected and old, and 1800s pa po ito, vaccine institute in Russia. And sila po ang nag-develop po nitong Sputnik and also known as Gamaleya vaccine. In the Philippines, we are now starting to use Sputnik and Gamaleya. So it might be a good idea for us to review po yung backgrounders, saan po nanggaling, how effective, saan po yung mga trials na ginawa, good points, bad points, and Philippine history po ng ating pong Sputnik and Gamaleya vaccines. Or Sputnik, also known as Gamaleya vaccine. Ako po, it's personal to me because one of my managers po was vaccinated with the Sputnik vaccine last May in Parañaque. So gusto ko rin pong malaman, and especially as more and more po Sputnik vaccines are arriving in the Philippines. So hindi na lang po Sinovac and Astra and Pfizer, but we also have Sputnik. So kailangan po nating ma-review kung ano ba talaga siya. So question A, point A is, ano nga ba yung Sputnik? Okay. The Sputnik is the same as the Gamaleya. It was developed in Russia. Okay? And it was, ano bang history nitong Gamaleya Research Institute? Since 1800s pa po, it was nationalized in 1919. It has been producing many kinds of vaccines. Nakilala din po yung gumawa sila ng Ebola and MERS vaccine. So now, in response to the COVID crisis, they have formulated the Sputnik vaccine. Okay? Saan po nanggaling yung pondo ng Sputnik? Sputnik was funded by the Russian National Wealth Fund. So talaga pong Russian po yung origin ng ating Sputnik vaccine. Okay, next. Letter B po, yan. How does it work? Ano nga ba? What is the mechanism of action po ng ating Sputnik vaccines? It is an adenovirus vector vaccine. So, ano po ang, I will explain to you the similarities po ng Sputnik versus other similar vaccines, no? So, adenovirus, A-D-E-N-O-V-I-R-U-S. Ipa-flash po natin in a few minutes. And parang you heard that na before, diba? Oo. What's the adenovirus? Well, that's the virus that causes the common cold. One of the viruses that cause the common cold. It is also an old technique. Kumbaga, hindi po bago. Ito pong paggamit po ng adenovirus with the way they made the vaccine. Ano po ba to? First of all, it's similar to AstraZeneca. It also uses an adenovirus. And it is also similar to Johnson and Johnson, J&J po, which also uses the same technology, which is an adenovirus. So ano po yung meaning ng adenovirus and how does it work? Okay. So ganito po yon. The DNA po or the instructions for the spike protein, yun po yung magiging antigen natin. O yun po yung makikilala ng ating katawan. The DNA po for the spike protein was karga-karga po ng adenovirus. Okay? So this adenovirus po enters our body through the vaccine, and then it will enter po, that adenovirus will be eaten by the cell. Your cell will eat the adenovirus. Kasi makikilala po niya na that adenovirus is foreign to your body. So, attack po ng ano nyo. Ngayon, si adenovirus po will enter your cell, and then lalabas po yung DNA ng spike protein na dala po ni adenovirus. And then, ano po, it enters the cells, it travels to the nucleus of your cell, and then the DNA that dala po ni adenovirus, remember the DNA of the spike protein na inactivated po yan. So it will enter po the nucleus of your cell and it will be read into RNA. And then the RNA will go out of the nucleus of your cell and begins to produce the spike protein. Okay? So the adenovirus is bringing the instructions into your cell, and then your cell will start to make the spike protein. Ang dala-dala lang po niya is spike protein. It cannot make the entire COVID virus. It will only make one small part, that is the spike protein. So the spike protein will now be expressed. Lalabas po yon from your cell. Makikilala po ng katawan nyo, ng defender cells nyo, aha, this spike protein is not supposed to be in our body. So, gagawa po yung katawan nyo po ng antibodies versus the spike proteins. And ito pong antibodies na to, these are going to be your soldier cells in the event po na kayo po ay ma-infect ng totoong COVID virus. Nagets niyo po? The adenovirus is only a carrier and it carries the DNA of the spike protein. It enters your cell will produce spike proteins. Spike protein lang, not the whole COVID, okay? And then, makikilala po ng katawan nyo na hindi dapat po yung spike protein na yun ay nasa loob ng body nyo, and you will start to make soldier cells or antibodies. And that is the start of your immune response versus COVID. Okay? So, this spike protein po or carried by the adenovirus, there are two adenoviruses po that will be used. Okay? The first po is adenovirus 26. Yun po yung magiging carrier po ng first dose ninyo. And then there's a second adenovirus, which is adenovirus 5. Yun po yung carrier ng second dose ninyo, which will happen 21 days after the first dose. So 2-dose vaccine din po ito. And the question is, bakit dalawa yung adenovirus, ba't di na lang isa? There is a concern po that your body might recognize the first adenovirus. And then pag second dosing po, baka awayin po ng katawan nyo yung unang adenovirus. So that is why they use two carriers, the first and the second, which are different. So what is, so yun po yun, ano? It's an old technology after the inactivated vaccine, inactivated virus po ng Sinovac. One of the older technologies din po, which is the way that we make vaccines, is the adenovirus technology. Okay, so this is old. Hindi po siya bagong discovery. Alright, next po.
Next po, letter C. Paano na-develop?
Okay, ganito. The phase 1 and 2, diba, I explained to you po that vaccines are done by phases. So phase 1 and 2 muna po tayo, 38 volunteers were injected in Russia. Okay, so these 38 persons, in-inject po sila to know the dose, to know if it's safe, ganun po, and to know if it's effective. So phase 1 and 2 po was done in Russia. And then phase 2 and 3, ginawa po sa Russia also. And there was also a phase done in India. So phase 3, after it's safe, we know the dosing, nag-umpisa po tayo ng phase 3, dinamihan na po yung mga tao, And nangyari po yan in Russia and India. Okay? So that happened po over over the last quarter of 2020. Nung November 11 po, there was a preliminary presentation po of the phase 3 trial in Russia. And then it was registered. The vaccine was approved EUA for emergency use authorization in Russia. The first country to authorize the vaccine outside of Russia was in December 22 po sa Belarus, in December 23 po in Argentina. And the Argentinian president, si Mr. Carlos Fernando, was actually vaccinated po with Sputnik. December 24, this is very interesting, di ba? I told you, Johnson & Johnson, AstraZeneca, and Sputnik, they have the same adenovirus. They're using adenovirus. So on December 24, there was an agreement with Astra and Sputnik. They are going to combine, halimbawa, first dose Astra, second dose Sputnik, first dose Sputnik, second dose Astra. There's an ongoing study right now of combinations of adenoviruses, adenovirus vector vaccines to see if AstraZeneca and Sputnik can work well together. So could you project, please, AstraZeneca and Sputnik trial? Meron pong trial which has been ongoing since December, and kino-combine po nila. Tinitingnan nila if the similar vaccines would work well together. So that's very interesting po na Astra decided to work with Sputnik. So on, parang hindi yata na pro-project. Sorry. Opo.
Letter,
So,
okay.
Okay, Astra and Sputnik together. Let me write it down. Parang hindi po tayo na project. Okay. So, ayan po. Astra and Sputnik trial. Okay, project lang. So, pinagsama po, the Astra and the Sputnik decided to test their vaccines together and to have a cooperative trial po, so that to see if combining them, because they have the same technology, if combining them would be a good idea. Okay? So yun po yun. That's the Astra and Sputnik trial, which is ongoing since December 24. On February 3, this is very important, there was a Lancet published article. The Lancet po is a very important scientific journal po, based in the UK. It's worldwide famous. Pinablish po yung phase 3 trials. So marami ng tao. No? There was a Lancet trial. The phase 3 trials were published by the Lancet on February 2. And eto po, this is what happened. No? So there were, please take down Astra and Sputnik, guys. So there were 22,000 patients po in Moscow. Pinag-aralan po nila, no? They enrolled, 2:1 po yung enrollment nila. And they did enroll seniors. So 16,501 were given Sputnik, and 5,476 were given placebo. So 2:1, ano? Nakikita nyo po, ano? 2:1. And tiningnan po nila the percentage of persons who developed COVID in group 1, which is the Sputnik group, and group 2, which is the placebo group, or walang laman yung bakuna nila. Okay? So nalaman po nila that the Sputnik group only developed 16 persons developed COVID, and 62 persons developed COVID na hindi na bakunahan. So basically, very effective po kasi mas mababa po talaga yung mga nabakunahan na nag-develop ng COVID. So they also found out during this trial po, no, phase 3 trial po in Moscow, that the side effects were well tolerated and minimal. Wala pong namatay, no? So the phase 3 trial, lagay po natin. Ayan. Nalaman po nila the side effects are minimal, nobody died. Wala naman pong na-hospital due to side effects. So the side effects were minimal. So effective and minimal side effects. Yun po ang nalaman nila during the phase 3 trials po sa Moscow, which they published in the Lancet. Okay? So currently, no, nag-expand na po sila. I think I sent something to be, posted, please. First phase 3 trial, yes. Yun po yung na-publish sa Lancet last February. And this is where most of the countries po did their emergency use authorization. Nung binasa po nila yung phase 3 trials, a lot of countries approved on an emergent basis po ang Sputnik. That includes the Philippines. So pupuntahan po natin yung Pilipinas next. Okay? Meanwhile, the phase 3 trials are now occurring in Belarus, the UAE, India, Venezuela, and some parts of Brazil. So dumami na po yung mga nag-phase 3 trial ng Sputnik all over the world. And Sputnik has also been given emergency use authorization in a lot of countries. Okay? Notably, Argentina talaga ang nakilala dyan sa Sputnik. So, next po.
Next would be letter E. What is Philippine history sa Sputnik?
Okay, sa Pilipinas naman po, based on the February published data po ng Lancet, the Food and Drug Administration of the Philippines approved Sputnik as the fourth vaccine. Approved na po ang Pfizer, Sinovac, AstraZeneca, and number 4 was Sputnik Gamaleya. It was approved on March 19 for emergency use authorization of patients for persons 18 to 59 years old. The first dosing arrived po on May 1, that's 15,000 doses. May 12, 15,000 doses. May 30, 50,000 doses. And 3 days ago po, sinundo po ni General Galvez and the IATF, they got 100,000 doses po sa airport. So total po, 180,000 doses na po ang napunta po sa Pilipinas. And these were not donated, these were purchased by the Philippine government. So this is how po, yung isang manager po namin was injected po in Parañaque City for Sputnik. Ano pong nangyari sa kanya? I personally know someone who received Sputnik. Okay po siya, she's doing well. She had her second dose na po. Wala naman pong naranasan na side effects and she's really back to work with us. So I now know people who got Sinovac. I know people who got Astra. Ako po, Sinovac, husband, Astra. Managers, Sinovac and Astra. And one person po in my office received Sputnik. Okay? So next question po. Okay, good points about Sputnik. From the published Lancet article, mataas din po yung efficacy rate po ng Sputnik. Okay? It was found to be preventing serious hospitalization and death po talaga. Nakalagay po 91.6%. But again, let's wait din po for the other clinical trials that are happening all over the world kasi ayoko mag-declare kaagad ng mga numbers. Kasi ongoing pa rin po yung mga clinical trials phase 3. Okay? Second good point po for Sputnik is old technology. Matagal na ho yung adenovirus. It is not new. So, we sort of know what to expect and ready naman po tayo kasi nothing is ever going to be completely perfect. But definitely, it's an old technology and it has been used many times. Okay? Third issue na maganda po sa Sputnik Gamaleya, well, aside from the cute name and the recognizable name po, no? But sometimes confusing po kasi people do not know that Sputnik is Gamaleya and Gamaleya is Sputnik. Eh. The other good point po dito, which is very, very, very interesting. Russia is a very big country. Sobrang laki po, no? And some of it is not completely developed. So malaking issue po sa kanila is logistics and transport. At dito po talaga pumapasok ang Gamaleya or Sputnik. Number 1, the price po is comparable with the lowest vaccines. Number 2 po, yung storage niya. It can be stored in normal freezer, normal freezer. There are 2 formulations eh, the liquid and then the freeze-dried. So, yung isa po, normal freezer temperature, 0 degrees, okay na po. I would like to mention that Pfizer and Moderna are requiring ultra cold, which is minus 70. Si Sputnik po and Gamaleya, 0 degrees, that's the normal freezer, pwede na po. And there is also a ref version, which is also stable po at ref temperature. So talagang malaking issues po ito. And this was developed in Russia to be low cost kasi ang dami-dami pong Russians. And number 2, good logistics and transport. Kasi po, not all of Russia is well developed. So meron din ho mga malalayo, mountainous, ano po. So they really made this so that the Gamaleya would, or the Sputnik would be able to be transferred to all parts po of Russia. And that's actually why a lot of developing countries are very, very much interested in this vaccine because of the low cost and the good transport. And kung i-combine po natin na acceptable side effects and good efficacy, ito na po yung ating very useful na vaccine. Okay, next po.
Letter
So areas
G.
of concern. Yeah, meron talaga. And it's hard to determine kasi, you know, there's a lot of politics coming into this. It's hard for us to totally determine po kung talagang valid siya o may politika talaga. Ang hirap eh. But so far, ano, wala naman hong maraming namatay. There's few reports. Most of the side effects are minimal. And there is a concern po in certain parts of the world na baka daw pwedeng mag-replicate yung adenovirus for people who are extremely immunocompromised. So, as a result, most people are now registering po Sputnik for the healthy individuals. Pero again, ito pong areas of concern na to, pinag-aaralan pa po. Right now in the Philippines, sa bagay, it's only 180,000, wala pa rin pong mga serious incidents with Sputnik Gamaleya. So again, we still have to wait for kuminsan maganda rin yung late ano. We are watching and waiting for results from the rest of the world. Konti pa lang talaga ang dumarating sa Pilipinas, but right now the experience po of the Philippines seems to be positive with regards to Sputnik po and Gamaleya. So, I think this is it. Our recommendation, ano, Sputnik and Gamaleya is a Russian-made vaccine. Again, it has undergone numerous trials. It has been found out in limited phase 3 studies to be effective and safe. And right now po, with the lack of vaccines, it seems to be a viable alternative, especially since it has a good price and it is well stored and easily transferred. So yun po yun. If you are offered Sputnik or Gamaleya at this point, I would say yes, do take it. And we are still waiting po. Right now, it's safe sa Pilipinas. Wala naman po tayong naririnig. And let's just keep in touch po for more updates regarding Sputnik and Gamaleya. So yun lang po and magandang hapon po sa inyong lahat.
From Ms. Rochelle Calma Alfonso, ilang days po ba bago ulit mag-second dose ang Sinovac vaccine? Paano po kapag lagpas na po pero hindi pa rin nabibigyan ng second dose? Hindi na po ba effective yun?
Well, ma'am, it is 30 days po for first of all, 21 days for Gamaleya. This is another good point po for Gamaleya which I did not mention, Sputnik or Gamaleya. Why? Kasi the faster you get your second dose, at least marireach mo na talaga yung dapat mong ma-reach na immunity level. Samantalang the longer, though you have some protection for the first dose, but you still haven't reached the maximum potential that you could reach. So this is another a good point for Sputnik. With regards po sa Sinovac, 30 days po talaga ang Sinovac. So my question to you is, bakit hindi po kayo nabakunahan ng second dose? Naubusan po ba ng Sinovac? Okay. Number 2, you forgot to go or you are traveling. Number 3, baka naman ho na-quarantine kayo. So for whatever reason po, no, the sooner that you can get your second dose po, the better. So if you're unable to get your second dose po of any vaccine, the moment you can get your dosing na, like meron ng bakuna, or nalabas ka na sa quarantine, please go and get your second dose, kahit late. Sana days lang, wag naman months or years.
From one of our viewer, who is or what is Gamaleya? I think nasagot niyo na po ito, pero let's just repeat the answer.
Yes, wala namang masama, no? Gamaleya is a pioneering Russian virologist and microbiologist. And this institute, which was 1891 pa po ito, was named after him in the honor po of his achievements. Sputnik is the spacecraft, and it's a world-renowned name. So Sputnik is actually a symbol po of Russian of Russian ingenuity, Russian scientific achievements. So that's why they named it Sputnik. But that's the same, ha? Sputnik is Gamaleya, Gamaleya is Sputnik. I did not know that also myself. I thought there were two.
From Mr. Raymond Alan Sese, good morning, Doktora. Sabi po ng iba, magiging mainitin ang ulo pag Sputnik na inject sa'yo. Ha ha ha, joke lang po. Thank you po for explaining the Sputnik vaccine. Very well explained. God bless.
Um, siguro joke lang po talaga yon. But yeah, I think that's a joke. And thank you for, kasi talagang may dumarating na ng Sputnik, and I was listening to a talk by IATF head, and he had to leave the briefing kasi he had to pick up the Gamaleya. So I said maybe it's time for us to discuss Gamaleya. Actually, it's also probably time for us to update, no? Sinovac and Astra. And then maybe Pfizer, Reina.
From Mr. Fred Manamtam, Doktora, despite the impressive results ng Sputnik trials, bakit hindi pa na-approve ng World Health Organization? By the way, got my second dose of Sputnik 3 weeks ago. So far, okay pa naman ako.
That's really nice to know, sir, na okay po kayo after Sputnik. Well, there's a lot of, I hate to say this, there's a lot of things na pinag-aaralan po ng WHO. There's also a lot of politics involved here, okay? May mga issues na, I don't want to get into inter-country fighting kasi hindi naman natin alam yun eh. But definitely, there's also a lot of politics involved. But all the data naman points out to be it being okay. There are countries widely using this like Argentina, Russia. Kung meron naman talaga masamang nangyayari in this day of internet, sisingaw na rin po yan.
From Miss McBride Ashley, Doc, bakit walang skin test ang mga anti-COVID vaccine?
Actually, we don't do skin test anymore. Dati po, noong unang panahon, we used to do skin testing, di ba, ng mga antibiotics. When I went to the US, hindi na talaga ginagawa yun. That was 20 years ago. When I came back sa Pilipinas, tinanggal na rin po. So we don't really normally do skin test anymore. Like, favorite ko talaga yun sa mga ER, di ba? Reina, ANST, after negative skin testing. Wala na po talaga. I don't think we do it anymore.
Yes, Doktora, actually, unless you declare to your on your patient history, you declare na meron kang certain allergies sa mga drugs, then that's the time na maggagawa sila ng skin test.
Pero actually, Reina, hindi na talaga. Kasi they found out you can pass the skin test but still have an allergy. So talagang wala na. I don't know. Maybe let's guess an allergologist, pero talagang hindi na po siya talaga ginagawa.
Actually, opo, Doktora, kahit po sa mga ibang
diba nanganak ka, diba dati?
Pedia, also for pedia cases kay Aki and Andy, they don't skin test na pag kami
wala na talaga. Parang I think they have moved on. But that is a good question kasi ako rin when I went to US, tinanong ko, ba't wala skin test dito? Sabi na, wala nang skin test. Okay, sabi ko. So we learn something every day. Parang hindi na po siya talaga recommended, ma'am. Opo. But thank you for asking that kasi ako rin, pinagtakahan ko rin yan.
From Ms. Tricia Ocampo, Doktora, good morning po. Ask ko lang po sana kung any COVID vaccine or Sputnik po is okay with someone who has asthma and allergic rhinitis.
Pwede po. In fact, if you have asthma and allergic rhinitis, you are A3. So, dapat po kayong mabakunahan pa. Hindi lang siya pwede, but actually the answer is dapat.
Okay, from Miss Angelina Ayuson Cruz. This is gonna be our last question po, Doktora.
Okay.
Yes, from Miss Angelina Ayuson Cruz. Yearly po ba ang pagpapabakuna ng mga vaccines against COVID?
That is a very, very good question, Miss Angelina. And dami na rin nagtatanong dyan, my answer to this question is, we still do not know the final answer. Kasi marami nagtatanong, doktora, may booster shots ba? Yearly ba? Hindi ko po talaga masasagot. And I don't think anyone can answer that yet. Kasi may issue na baka some vaccines are not as effective as others. So, kailangan ma-booster sila. Malaking balita yan about Sinovac. Meron namang nagsasabi, once you get vaccinated, even if your vaccine is not the number one effective, pag lahat po na bakunahan, di wala ng COVID, ano? So, we are still moving towards the answer to that question. But ako, as having been vaccinated with Sinovac, and this issue comes up a lot with Sinovac, is sa akin I'm just happy to the Lord that I got vaccinated and I just don't want to die. So okay na rin ho sa akin yung death, hospitalization, and serious COVID. Sa akin that outcome is okay. And then moving forward, kung minsan maganda rin yung huli, that's what I always tell people, malalaman din po natin kung ano po ang dapat nating gawin. Kasi, ito sinabi ni General Galvez, and I know this from having studied UK data. Pag umabot po ng 30 to 40%, mabababa po talaga yung yung COVID rate. So the question is, if the COVID rate is really going to be really low, do we still need to be vaccinated after? Hindi pa natin alam. So right now, let's just concentrate po muna on first dose. Let's concentrate on second dose. And then let's concentrate po on vaccinating all those around us. Kung ikaw na bakunahan na, pabakuna mo ni nanay mo, pabakuna mo yung tatay mo, pabakuna mo yung empleyado mo, yung kasambahay mo, yung kapitbahay mo. Kasi when you are surrounded by vaccinated people, kumbaga when you're surrounded by COVID positive or not vaccinated, pwedeng masurround ka ng COVID positive kasi pwede sila ma-COVID. Pero kung bakunado na kayong lahat, wala nang malilipatan yung virus, and because of that, you're gonna be safe. And that is the concept of herd immunity. So I don't know pa po about this and remains to be seen. So sa inyo po lahat, thanks so much for joining us. We talked about the SPUTNIK Gamaleya vaccine. Ito lang po, refresher, it is a Russian-made vaccine. It has undergone much testing po. The results have been published in an international journal. Other tests are ongoing all over the world. So far, wala naman po talagang nababalitaan na very bad stuff na nangyari po sa Sputnik. I haven't heard of anyone who died. Sa Philippines po, 180,000 na po ang doses na dumating. It is now approved by the FDA. And I would strongly recommend kung pumunta po kayo sa isang lugar na vaccination site and na-inform po kayong Sputnik, wag po kayong aalis. Tuloy-tuloy lang po. Okay? So sa ikauunlad po natin and for all our safety, all of us, magpabakuna po tayo. Thank you so much and magandang hapon po.